Retina is basically the nervous tissue of the eye, where light basically enters the eye, is converted into electrical signals and sent ahead to the brain to further sort of process and tell us as to what we are seeing. A percent of patients in which retinal detachment is genetic. So the fact that your father has developed retinal detachment tells us that we need to screen your eyes at a more regular interval to make sure that you are not at risk or not going to develop this issue in your lifetime. Complaints of flashes of light, multiple floaters suddenly occurring in front of your eyes, followed by a drop in vision are the three most common symptoms that a patient will come with. There are certain predisposing conditions that can lead to a retinal detachment. So these are caught at a routine, regular evaluation. If these are taken care of in a timely manner, then the risk of developing a retinal detachment in the future significantly reduces. A detailed eye evaluation is required, where a special care is taken to see the back part of the eye. This is good enough to identify a retinal detachment, but certain scans, sonographies or eye photos may be taken to confirm the diagnosis. There are various types of surgeries that your doctor will discuss with you in detail, because that depends from case to case. But other than surgery, there is no other treatment available. It depends on what type of retinal detachment surgery you've undergone. Doctor may sometimes use gas or oil inside your eye and ask you to maintain a specific position to make the retina stick back in its place. This is usually ranges from 3 days up to 2 weeks. Other than that, special drops and oral medication is usually suggested, which varies from a month to 2 months time. If you're lucky and the central part of your retina, which is the most sensitive area, is not affected in the retinal detachment, there are chances that you may regain 100% of your vision, but this happens in a very small percent of cases. It depends on what surgery you've undergone. From 3 days right up to 2 weeks is the time your doctor may ask you to take rest. Subsequently, looking at the progress inside your eye, your doctor will suggest you as to how soon you can resume your work.